Ladies and gentlemen, thank you for standing by, and welcome to the New York State Clinical Data Management System, used for medical countermeasures, response, and population management webinar. During the presentation, all participants will be in a listen-only mode. Afterwards, we will conduct a question and answer session. At that time, if you have a question, please press the 1 followed by the 4 on your telephone. If at any time you need to reach an operator, please press *0. As a reminder, this webinar is being recorded Thursday, September 18th, 2014. I would now like to turn the webinar over to Luann Lance. Please go ahead.
Thank you very much, everyone. I am thankful to be invited today to present our New York State Clinical Data Management System for use for MCM response and population management. The Clinical Data Management System is a system that we have developed within New York State. It's a web-based application. It sits on the New York State Department of Health Commerce System, which is actually our internal server within the Health Department that many state health department applications sit on, including immunization registries, other state aid applications, other emergency surveillance, and laboratory systems as well. The whole point of the Clinical Data Management System is it provides a local, regional, and state health departments with a single online data collection tool during an emergency. We collect patient demographics, medical countermeasure information, and we're able to use that throughout an emergency response. The goal really of the system is to be able to use it regardless of the hazard agent or event involved. We've used it for flood incidences, for Hurricane Sandy. It was used through H1N1. It's been an evolutionary process, and there's been a lot of upgrades over the last few years, and we're really continuing to work towards making it an all-hazards application for data collection. It captures recipient and demographic information, as I mentioned before, and also visit information. So any of the data collection elements for somebody presenting at a public location. In this case, we have used it for points of dispensing, but we're also trying to move towards making it all hazards, which it then maybe could be used for community reception centers during a radiation event. We've had some bumps in the road with CDMS over time. It was actually started back in 2007, and as you can see on the left-hand side of the screen, it was started with these bubble forms, which is very similar to state testing. A lot of complaints from the users that it was difficult to read for recipients as they presented. They were handed this document, and they had to self-populate all the information. The bubble forms then used optical and handheld scanning, and the output was sketchy. So the bubble forms were abandoned at the end of 2008. In 2009, with the advent of H1N1, it was moved from a third-party developer to an in-house application, and state health department developers were engaged to try to move the application forward. It was migrated to in-house Oracle Java framework. Handwritten paper forms and online capabilities were ignored. It was scanned form images, so it still was a paper system. And individuals filled out the paperwork, and then it was uploaded for manual data entry. The problem was that the character recognition was very poor, and at the end of this period of time, it was determined really that the data was really inconsistent with how it was transferred within the system. However, there was a NISIS data transfer, a lot of manual entry after H1N1, so information did get into CDMS, but subsequently there were a lot of man hours that were necessary to subsequently do duplicate data entry into the New York State Immunization Registry. In 2010-2011, the OCR capabilities were abandoned. There was a sort of a reinvention process during this time, and I have to give kudos to a lot of my colleagues. This was just somewhat before my time, but after H1N1, there was a lot of angst about the form, the capabilities, the ease of use, and actually the output of data. So basically during the 2010-2011 timeframe, it was sort of reinvented to become more of an online form. Paper backup, but essentially being able to enter the information electronically to collect the data rather than depend on form scanning. During this period, there was a lot of user input. Counties, local health departments were surveyed, state health department folks that were engaged with CDMS to try to get some user feedback. One of the key things that the users identified as a priority was a pre-registration functionality to allow recipients that are going to present to large public venues to complete their demographic information and their medical screening in advance of coming to the pod or the point of dispensing. So that functionality was introduced in fall of 2011 to the local health departments. During that time also, the medication and provider lists were enabled barcoding so that if there was a provider, and by provider I mean the individual that's actually providing the medical countermeasure, could be populated and a barcode could be created and their name could be scanned in electronically rather than typing the information into a data field. During this time it was also identified that user manuals might be helpful for users that are not familiar with the system, and enhanced user manuals were also developed during that period of time. In 2012, further development occurred where the barcode scanning that was developed earlier was great, but during some events where there was a limited number of either medical countermeasures or providers, it seemed it might be useful to move towards some drop-down menus so it could be a point-and-click part of the application rather than a lot of data entry or having an extra piece of equipment with a barcode scanner. The barcode scanning was not abandoned. It's still available. But just to try to simplify the procedure, we gave the user the option of doing drop-down boxes, and I think that's been really well received. I anticipate in a large event where there are multiple maybe medications or vaccines or medical countermeasures of any kind that may have individual mechanical numbers or lot numbers or NDC codes, and there's a lot of change throughout the process, it may be still useful to use the barcode scanning to avoid errors. But for a limited number of providers and countermeasures, we found that the drop-down lists really have reduced data entry errors. Also in 2012, we started requiring the use of the clinical data management system for points of dispensing exercises. Up until this year, it was highly recommended during annual exercises. And counties, as we found out, sort of reverted back to a comfort zone of using paper forms. So we really wanted to promote this and try to transition users into doing something electronically. And so we started requiring this. And it started to work out much better that way. And we've been doing that ever since 2012, requiring it. Going into 2014-15 grant year, we are not only requiring CDMS, but we're requiring a doxycycline ciprofloxacin exercise, which enables us to use an algorithm. As you can see at the bottom of your screen, this smart form was piloted, and that is the form with an automated screening algorithm. This is an algorithm that we can develop in-house. So it doesn't necessarily have to be antibiotics. It could be any decision-making matrix that resulted in triaging individuals towards one countermeasure or another. And for today's demonstration, I worked with our environmental health staff to develop a radiation algorithm that might make more sense to the group that we're presenting to today. So the CDMS functions and benefits, there's a couple big things. Again, the pre-registration is the big one. And what we found is that really helps participants plan and allocate resources. If the majority of the population pre-registers, they know how many people to anticipate. They can actually export all of that pre-registration data so they can anticipate who to expect, what kind of medical screening has been completed. They can actually go in and look at the medical screening questions and determine what kind of medical countermeasures they may need. So it really helps planning for resources, and in particular it really helps in managing staffing and personnel resources if they have some idea of the population they intend to expect at the point of dispensing. We've also found that it reduces lines. If people are pre-registered, there's less people standing in line, less interviewing that's going on. And some of the examples that I can give is we had a large pod at a facility at one point, and they had not separated out the lines. They had both individuals that pre-registered and individuals that were registering at the site, both in the same line. So as anticipated, there were people that were pre-registered and were concerned that they weren't being processed quickly enough. So the facility at that point decided to have two lines, sort of like an easy pass. The folks that were pre-registered were going to go more quickly through one line, and the other folks that needed to fill out the paperwork were going to stay in one line. What we found out quite by accident is that the individuals that had not pre-registered were seeing that the line on the right was going much more quickly, so opted to pull out their smartphones or their iPads and register while they were in line, and then sort of line jockey to the line that was going more quickly. So we really found that to be helpful. It also increases throughput rate. I mean, the goal, of course, is to process as many people as quickly as possible through a location. And without having to collect data at the site, we found that it really decreases the time between stations and also decreases the time within the point of dispensing operation, and subsequently improves recipient satisfaction. We also have some drop-down lists and barcode scanning, which I mentioned earlier, and just this really helps increase data entry speed. Many of the staff at points of dispensing operations are volunteers, or they may not be as familiar with the application, so therefore a lot of just-in-time training needs to happen. And this really increases the data entry because there's less opportunity for typing and potential errors, and this also helps move things along more quickly. One of the big things with vaccine was the need to do dual data entry prior to this capability being introduced. This is for vaccine-related events. And this was the ability to automatically transfer the data that was entered in the clinical data management system directly to our immunization registry. Prior to that, again, if it was a vaccine-related event, it was not an incentive to use this system because it involved a lot of man-hours with entering it into this system and then turning around and entering it into the immunization registry, which is required for children under 18. The Smart Form, as I mentioned before, was introduced, and that provides decision-making guidance with a built-in screening algorithm that is flexible. It can be done with any scenario. It does allow for skip questions, and it reduces the need for medical evaluation. So if there's any kind of holdup or potential questions, this allows non-medical personnel to participate more readily. For our doxycycline ciprofloxacin algorithm screening tool for a simulated anthrax event, we actually have had that medically approved by physicians within the health department, so that once an individual presents at the pod, there really isn't any decision making that needs to occur. If there are questions, one of the pieces of the algorithm is actually to refer the individual to medical evaluation. And this, because we can develop it based by event, it supports an all hazards approach. Real-time data collection. This really reduces retroactive data entry. It allows line of sight accountability. It provides real-time situational awareness. We know who got what when. We know what time they were there. We know what their demographics are, and it helps really with following up with potential adverse events or if there's any follow-up necessary with the recipients. Just this year we started with some aggregate reports and filters. Although we had the ability to get the information prior to this year, we had to go into each point of dispensing location, export the data, and then sort it. This year we're able to get state, regional, and local reporting. So we can actually select the points of dispensing. We can select them all. We can select a few. We can select just one. And we can export the demographic information, recipient age, countermeasure provided, provider information, any of the information we collect on the electronic form. We can export and we can sort that information. It's exported into an Excel file. So we can sort the information by age ranges, or if there's a zip code that we're looking for or an address that we're looking for. It's very, very helpful for situational awareness. So in a real event, for example, I could today, right now, if there's something going on, I can pull up how many people have actually presented to all the points of dispensing in New York State as of now. And I can also get information on what medical countermeasure they have received. So we find that really, really valuable. It also helps with reporting for after action information, and it really is helps us provide real-time situational awareness. One of the things that we've experienced in the past is if they say, how many people did you get through your community reception center, or how many people did you get through your point of dispensing, it was an estimate unless you had a timekeeper. Most of the time the total numbers weren't available until you were able to collate all the paper documents after the event. So we found this to be really helpful. So the practical all hazards applications, again, this is where we're working towards for development this year. We're not completely there yet, which I'll point out during the demonstration. But at this time, the system works very nicely for medication-related events, vaccine-related events. So some of the things that we've used it for has been hepatitis A outbreaks, pandemic influenza, any other outbreak that requires a medical countermeasure intervention. This last year we used the system to trial phlebotomy during a equine encephalitis study that we did up in central New York. So the system is designed to be able to respond to a number of different public health emergencies, and we're trying to transition some of the terminology to make it more all hazards. You'll notice during the demonstration there's terms like patient and medication, and it is very medically focused at this time, but during development of this year, our goal is to really transition that to, instead of patient, recipient, or person, and instead of patient information, personal information, so we can use it for a variety of events and a more all hazards approach. So some of the enhancements that we're working on for this year is to provide fields for unlimited number of medical countermeasures. At this time, as of today, in production, we can enter 2 medical countermeasures. Our developer has promoted, and we don't have it yet in production, but I anticipate it being any day now, that we'll be able to add an unlimited number of medical countermeasures. So if an individual needed an antibiotic, a vaccine, face masks, some level of personal protective equipment, maybe they needed a blood draw, maybe they needed a urine sample collection, we would be able to have a number of different fields and add as many as we needed depending on the event and depending on the number of medical countermeasures we would need. I already talked about creating an all hazards format with the language, and we also anticipate trying to paginate the system, so rather than scrolling down a long form, we'll be able to have greater accessibility by tablets and smartphones with pagination and shorter pages. A long-term goal is really to integrate with other preparedness applications, such as our inventory system that we have statewide. And this year we're in development for creating a form for community reception center data collection. So although I've developed a form for today's demonstration, as you'll see, the form is still very focused on medication. But within production this year, we anticipate rolling out a radiation instrument that can be used at a community reception center. And our longer term plan is to at some point allow for disconnected use. At this time we need to have internet access. Most of our counties we're seeing as they're replacing electronic equipment are going to tablets or iPads because of the price. It's much less expensive than laptops. The battery charge stays up longer. So we really need to move towards what our partners are moving towards as far as equipment purchases. Okay, I'm going to share my screen here in just a minute and pull up the system and do a short demonstration for you. I do want to leave some time for questions at the end. So I'm going to move through this demonstration much like if I was registering an event and then the individual presented to the point of dispensing. This is the public website. The pre-registration system is located right on a public website. There's no need for a login and password, so anyone that needs to register from their homes or from a community center or from a library can go in, select the clinic that they plan on attending, and go in and complete all the demographic information and the medical screening information. So give me just a second here to share my screen. Okay, this is our public website page. There's an unexpected error. It's because I clicked the back button to advance to this, but the registration is set. This is the information the recipient sees. They actually can go in and fill out demographic information. The instructions indicate to select the county from the list. These are all New York State counties that are currently using this system. Some of them are using it for seasonal influenza vaccines. Some are using it for training at this point in time. I am going to show you something quickly from a county that is doing a training. This is an area, this required entry code field right here, which I think is very, very helpful in the event that it was a select population that you would want to serve. So for example, if you only planned on serving first responders, you may want to limit that field so the general public doesn't have access to it. So you can actually put in an entry code and share that code only with the population that you're serving, so they are restricted from moving forward and filling out the medical screening and demographic information. Okay. So the system does not like the back button, so I need to click the back button down here below. So I have training campaigns set up under New York State Department of Health. And as you can see, this is the location of the point of dispensing operation, or the community reception center in this case, that we've put together. Much of this information is already pre-populated on the administrative end of things, which I'll show you when I get to the application. It doesn't take a lot of time to set these up. They're all individually set up. It looks complicated. It's not at all. Once you establish the location, many of the locations are set up in advance if you already know the demographics of that. There is a link here for map and driving directions that will take you to a Google Maps site where individuals can put in their information to get directions to the location. There's also an area for who this is for, and there also can be other information added to this with special instructions. So I have a 30-minute time interval here. These can be set up for as low as 5-minute time intervals or for as long as 4-hour time intervals, and you can put as many appointments as you want during each time interval. I've added a few patients in here for the purpose of demonstration. But I'm going to register an individual. You can see that the red fields are the required fields. If you do not fill out these fields, it will give you an error message at the top with a link to that location, so you don't have to go in and fill out each site separately. The phone number is required. If you don't have a phone number, you can just put in any number and it'll accept that. There is a field here for if the individual is not a U.S. resident, you can put not USA, and then it will not require you to put a state and a zip code within that field. It does allow tabbing over, which makes the data entry very easy. Once you add the county, it does not need to be a New York State resident. If it is a New York State resident, you would select the county that they reside in. If not, there is a not New York State selection up here. We do in New York State have a lot of folks that are border states. So we do get people from Connecticut, Massachusetts, Pennsylvania. It's not uncommon to get somebody out of state. Not to mention there may be visitors that are visiting family or for whatever reason are located in this jurisdiction. The date of birth is required. And for person less than 19 years old, the mother's name and the mother's maiden name is required. And this is kind of a holdover from vaccine-related events. This information is required for anybody that needs to be transferred into the New York State Immunization Registry. That's how they determine whether there's duplicates within the system. If they're not 19, you won't get an error message, and under 19 rather, and you can move forward and fill out anything that is either required or optional. So I'm not even going to fill out this emergency contact information or physician care information. You certainly can, but again, it's not read, therefore it's not required. I put in my wrong birth date. It does require you to put in 19 and not just a two-digit number. And you can see with the error message that you got here, if you click this link, it will take you right to that field so you don't have to scroll down and find the field in case you made a mistake. And this is, I think, really helpful for the general public. These are the medical screening questions that we put in. There is no filter on this side, so individuals can fill out as many or as few as they can. If they don't understand a question, we certainly designed it this way intentionally. If we can collect as much information as we can, that would be great. If we can collect it all, that's even better. But we do understand that individuals sometimes may not understand the questions, or they may be poor historians, or there may be some other reason that they cannot fill out this information. Okay. Once this is filled out, you can see that there's blue links. Individuals can go to those blue links and they can change that information without having to start over. I'm not going to do that. And then just register. This allows individuals also to have driving directions. If they choose to print a ticket, there's a PDF file that they can print off. This is the registration ticket that they can bring with them. It has the address, the location, their time frame. It also has a barcode. So if they present to the clinic and you prefer to use the barcode scanner, you can scan this in. It'll populate it and take it right to their record. Sometimes that's not necessary. You can just search by last name. There's many different ways you can search. Okay, so down here there's a spot for if there's a number of different people within the same family that can register during this period. They certainly can do that. It'll fill up the slot that's there. That way family members don't get bumped from one time slot to another. If there's an overage, we do allow for that. So those numbers for those intervals are an estimate. And that's all there is. You go back to the main screen. So that's really pretty simple and easy to do. Now the individual is registered, I'm going to go into our application and demonstrate what it would be like once they got to the location. Okay, this is the clinic data management system, and many of these administrative tasks and clinical tasks I have on the left side of the screen only I have access to. Depending on what access the user has allows them to have as many or as few fields as necessary. So this is, you may have some workers at your locations that you don't want to have the ability to create forms or to generate locations or do a lot of admin tasks. And you can limit the amount of fields that they have access to. So we're at the Community Reception Center now, and individuals are starting to stand in line and present. And so now we're going to recall pre-reg patient records. That's the individuals that we just pre-registered. We're going to set the campaign. The campaign is the big event. I have Radiation Readiness. A good example is Hurricane Sandy. Something that may cross jurisdictions. Whatever your response is what you would call a campaign. And then the form is what you have very specific to that event, that campaign. And then the county where your reception center is located. So at this site, that's where you could essentially scan the barcode that you have. If you have a barcode scanner, if the individual comes with their piece of paper, you can certainly do that. Or you can just search. If you just click the search button, it will search everybody. Or you can start typing in their last name. I have a few patients in here. Patients, recipients, trying to make it all hazards. And I just put in William Smith, so I'm going to select him. You can also see that there's this export records down here, and earlier I mentioned you can export all your pre-registration information before anyone gets to your location. This is where you would do that. This will give you a little bit of a reminder that says that William Smith is not on time. He was supposed to be there this morning. Do you want to proceed? We'll say OK. And then it does refresh to his record, and you can see much of this looks familiar. It's what he filled out on the public website. You can review this information for accuracy. Normally during a point of dispensing we'll say, has anything changed since you filled this out online? You may want to add information if there's something specific that you would like to have if they did not complete, for example, a primary care physician. And then go down to the medical screening questions, and I'm just going to put in my initials. And you can see that there's an algorithm built in here. William Smith was a first responder. So you can see once it's a first responder, he has gone to an endpoint. You can hover over this and it will give you any information related to that. The questions that are not applicable to where he's going to go next are grayed out. The information is still there because it's information you may want to look at when you do an evaluation of this individual. If I click Apply Intelligence, it's going to tell me that this individual is a first responder. He should be referred to Portal Monitor and collect a bioassay. No further questions need to be answered. So the individual that is responsible for medical screening can know what to do with the first responder next. So now we're going to refer the individual to medical screening. In most areas it's more than one location. If they left one station, I would create the record at that point. And then at the next station, where they may be providing a medical countermeasure, they can pull up the individual that's already gone through the medical screening. Depending on the setup, some of these tasks are done together, some are done separately. It allows for the flexibility however you set up. If you're going to do the medical screening and provide the medical countermeasures at the same spot, you can simply scroll down. So the disposition is referred for medical countermeasure, and this is where you can see it's still very medically focused, and this is something that we're working on to change this year. Actually, it's in process as we speak. Instead of a medication, we understand that it needs to be medical countermeasures, so it can include things like bioassay collection, portal screening. It also requires an administrative site. That's something that we are modifying so we can determine phlebotomy or things that may not be medication focused. This is really designed for vaccine-related events and oral antibiotics or antivirals at this point. But this is being modified now. I'm going to click something or it won't let me proceed. And this is the drop-down list that I mentioned before. I think you saw it under the bioassay or portal collection. This is select provider. I'm going to select Adela, and this would indicate that this is the person that actually provided the medical countermeasure. And then we can update record, and they're good to go. Next patient we can pull up, we can do the same thing, and we can continue on if we were registering individuals and follow through. And over we could provide the same information. So each time that information is saved and collected, it's available to us for reporting purposes. Okay, you can see that this individual has the endpoint for this individual who answered no to pretty much everything is of no risk and may be discharged. So you can see, depending on their medical screening questions, you can develop an algorithm on how they should be processed from this point forward. Again, this may not be 100% accurate, but we wanted to demonstrate something that would make good sense to the folks on the call today. Okay, now the very last piece that I'd like to show before I'll open it up to questions is the ad hoc visit reports. As I mentioned earlier, this is something new this year that allows us to collate all the information and all the data that's collected. I'll show you a couple different events so you can see the magnitude of how you can pull from events and counties. For this demonstration, I just did the New York State Department of Health. These arrows are where they're double arrows. You can move the entire group of jurisdictions over, or you can click them one at a time and move them over one at a time. If New York State Department of Health had several different locations, or if it was a county that had several different locations, if it was more than one county that had several community reception centers, they would all be listed here separately. You could either move them all over with the double arrow, or you could select the ones that you were interested in one at a time, and you would be able to get reports on the activity in those locations. These are the columns that you can select. They're any of the data collection elements that were filled out on the form, including the medical countermeasure. You can see there's a lot of variables here, so it's a lot to select. If you wanted to simply figure out how many at this community reception center, how many individuals, and maybe their birth dates, you'd be able to move that information over, and then this information would be exported to an Excel file, and you would be able to have the information there, and you can sort it in any way you want. I think what we find, again, we mentioned earlier, the situational awareness. It gives you a real-time number of how many people actually presented to that particular location or to all locations, what the birth dates were, whether they were male, female. Any of the demographic information that was collected is available to be exported into this report. This filter is really specific to medications at this point. It's the medical countermeasure lot number and NDC code. But you can also sort individuals that you have selected over here in, by age group. So for example, maybe you want to know how many children 18 and under you have served. You can certainly put the age ranges in 18 to 0 and extract that information. If you're interested in another age group, you certainly can do that. The very last thing I'm going to show you is I'm going to pull up Hurricane Sandy. I'm not going to export any data, patient data obviously. Oops, wrong one. And you can see that these are downstate counties that were more severely affected by Sandy. And you can see the number of clinics or locations or pods or centers. If you were doing a community reception center, this would be a location of each of your centers. You would define that in the admin end of things with the addresses and phone numbers, so individuals would be able to get directions to that location. If you wanted to just select one of these to evaluate the activity at that location, you can do that. If you want to know exactly what's going on with the whole lot of them, you can certainly do that. Let me try to pull something up here that's not. So I want to export the type of countermeasure that they received. And then this will prepare an Excel spreadsheet with all the names of the medical countermeasure 1, medical countermeasure 2. It may take a little bit because it is kind of a large list. But that is very helpful to look at a large event like that and be able to determine what kind of medical countermeasures they received. In this particular case, the countermeasures were primarily Tdap and influenza vaccine. But if there was any other interventions, for example, your portal monitoring or a bioassay collection, you would be able to determine who got what kind of countermeasure. And you could see this is the list. And you could see that some folks got 2 medical countermeasures, others did not. So you can sort that data. Obviously I didn't include any demographic data for the purpose of confidentiality, but I just wanted to demonstrate, a large volume of data, how you can collect that if there's a big event. Okay, so I think that concludes my demonstration. I think I could take questions now if anybody has any. I don't know if they're going to open up the line for questions.
Thank you. Ladies and gentlemen, if you'd like to register a question, please press the 1 followed by the 4 on your telephone. You will hear a 3-tone prompt to acknowledge your request. If your question has been answered and you would like to withdraw your registration, please press the 1 followed by the 3. Ladies and gentlemen, as a reminder to register for a question, please press 1-4 on your telephone. And at this present time, there are no questions from the phone lines.
Okay, great. I wanted to leave you all with the public website URL, just in case there is you would like to go out and try to register for that one of those New York State Department of Health sessions to get a firsthand feel for what it's like to register in advance. And I would also like to leave my contact information. If there's any questions, feel free to reach out to either Adela or me, and we'd be happy to go into a little bit more detail if there's something specific within the application you think you would like to know more about, you would like to see in more detail. I gave simply a brief overview of the system itself, the pre-registration, and the ability to collect data elements for a community reception center or for a large point of dispensing, and the potential for developing useful situational awareness reports. And thank you very much for allowing me to present this today.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation. Ask you please disconnect your lines. Have a great day, everyone.